Hey everyone, and welcome to The Explainer. Today, we're diving into a super practical playbook for a scenario you see all the time. That patient who limps into the pharmacy after a weekend warrior moment. We're going to break down everything you need to know to assess and manage these minor sports injuries, right from your spot behind the counter.
So, here's our game plan for today. It's set up to follow the natural flow of a real patient chat. We'll start with the big picture, then jump into how to size up the injury, what to do in the first 24 hours, dig into our pharmaceutical toolkit, and wrap it all up with how to coach for prevention.
All right, first up, the big picture. Look, we're always telling our patients to get active, right? But more activity, well, it naturally means more minor injuries. This is all about framing our role in that reality.
I really love this quote because it gets to the heart of what we do. We're not just treating a sore ankle, we're helping people stay on a healthy, active path. Our advice is what ensures that, for them, the amazing benefits of exercise will always outweigh the risks.
Okay, this brings us to one of our most important jobs, triage. Seriously, before you can recommend a single thing, you've got to know what you're looking at. This section is all about telling the difference between a simple soft tissue issue and a major red flag.
Okay, so first we have the classic sprain. Your patient's story is going to be key here. They'll tell you they suddenly twisted or rolled something, usually an ankle or a wrist. You want to ask how it happened, because that's what helps you know it's a sprain and not a strain.
Next up is the strain. This is what people mean when they say they've pulled a muscle. It's way more common in those big muscles, like your hamstrings or back, and usually happens from overstretching. So the key difference you're listening for is, did they hurt a ligament or did they hurt a muscle? And what about that nagging pain that just won't go away? You know, the kind from doing the same motion over and over? As soon as you hear tennis elbow or pain in the Achilles tendon, your brain should immediately go to tendinitis. It's a textbook overuse injury and usually something we can really help with.
Now, this is absolutely critical. We have to know our limits. Any of these symptoms you see here, confusion after a hit to the head, any vision loss, a nosebleed that just won't stop, these are massive red flags. Our role here isn't to treat. It's to make sure they get to a doctor or an ER immediately. No exceptions.
All right, so once we've made sure it's not a major emergency, our first line of advice is all about what to do without medication. This stuff is so foundational to getting that healing process started right away.
You know it, you love it. It's the Rice method. It's still the gold standard for a reason, right? It's just a super simple, super effective thing you can tell every patient. Rest, ice, compression, and elevation. It hits the pain and swelling fast and stops them from making the injury any worse.
Okay, here's the question we get a million times a day. Should I use heat or ice? The answer is all about timing. For the first day or two, cold is king. It's all about reducing that initial swelling. After that, you can bring in the heat to help relax tight muscles. The easy rule to give patients: cold for swelling, heat for stiffness.
All right, now we're getting into our wheelhouse, the pharmaceutical toolkit. This is where we take our assessment and match it with the perfect over-the-counter product, and this is just as important, the right counseling.
So here are our go-to players on the OTC shelf. And look, our value isn't just pointing to a box, right? It is all about the counseling. For acetaminophen, you've got to stress that max daily dose is from all sources. For oral NSAIDs, we're screening for GI issues. And for that really localized pain, topical diclofenac is just a fantastic option, especially for older adults.
Okay, let's talk about those rubs and creams, the ones with menthol or methyl salicylic. There is one piece of safety advice that is an absolute must-give, and it is non-negotiable. It's highlighted right there. Do not use these products with a heating pad. Ever. That combination can cause some really nasty burns, and it's so easy to prevent with one simple warning.
And last but not least, our job doesn't stop when the pain does. We have this amazing opportunity to be a health coach, to give advice that keeps our patients in the game and stops them from coming back with the exact same injury.
These are the simple, powerful tips you can give your patients. Just hammering home the basics, warming up, stretching, staying hydrated can make a world of difference. And maybe, most importantly, we can teach them to actually listen to their bodies. That's the real key to preventing injuries down the road.
So, let's wrap this up with a big question for all of us. As our scope of practice keeps expanding, think about things like minor ailment prescribing. Our role in managing these kinds of injuries is only going to get bigger. Mastering this playbook isn't just nice to know anymore, it's becoming absolutely essential for the future pharmacy. Thanks for tuning in to this explainer.